Hello dear doctors, nurses, medical students and healthcare team. How are you today? I hope you are well. Here we are going to explain next question about cardiology. Okay, a 50-year-old female presents with shortness of breath and palpitations which has been ongoing for the past few hours. She has ankle swelling which has been present for more than a year and feels difficulty in breathing while lying down. She is a non-alcoholic. A chest radiograph shows evidence of cardiac enlargement. What is the single most likely cause of her worsening conditions? Okay, A. Ventricular tachycardia. B. Paroxysmal supraventricular tachycardia. C. Ventricular fibrillation. D. Atrial fibrillation. E. Ventricular ectopic. Okay, the answer is atrial fibrillation, and here we are going to explain more about this patient. Okay, explanation: ankle swelling and orthopnea are features of heart failure. These features is combination with the history of alcoholism gives us the hints of an alcoholic cardiomyopathy, which is a type of dilated cardiomyopathy. Atrial fibrillation is the most common arrhythmia that develops in patients with dilated cardiomyopathy, and this is an important note. Atrial fibrillation is the most common arrhythmia that develops in patients with dilated cardiomyopathy. Okay, acute decompensation can occur especially in patients with asymptomatic left ventricle dysfunction who develop atrial fibrillation, and this causes the sign and some symptoms of their patients. In some scenarios, there is a setting of acute alcohol use or intoxication followed by palpitations, dizziness, and syncope, which can be attributed to arrhythmias such as atrial fibrillation or flutters. This is known as holiday heart syndrome. Why? Because the incidence is increased following weekends and during holiday seasons. Atrial fibrillation presentation: dyspnea, palpitation, syncope or dizziness, chest discomfort or pain, stroke or transient ischemic attack, and irregular pulses. The patient has irregular pulses. This ECG is showing atrial fibrillation. As we can see, their pulse is irregular. There is no any consistency between or intervals, and also we cannot see any normal P waves. This specification is called we can see a rugged baseline here, and this is called F wave, which is the feature and specification of patients with atrial fibrillation. This baseline, which is rugged, and we cannot see any normal P waves, and the atrial rate is increased more than 350 beats per minute, and which is their specification of atrial fibrillation. Here was a short explanation about the patient which is coming with atrial fibrillation. Thank you for your attention.